Hi, I'm Dr. Adam Lipson. I'm one of the partners and neurosurgeons here at IGEA Brain Spine in New York and New Jersey.
I'm Dr. Cyril Randazzo. I'm also a neurosurgeon at IGEA Brain and Spine.
So Cyril, we wanted to talk today a little bit about aneurysms, and you're a very recognized specialist in this area doing both open and endovascular treatment. Maybe we talk a little bit about defining what's an aneurysm, how you approach it with patients.
So what we treat at IGEA Brain and Spine is brain aneurysms. And what a brain aneurysm is an outpouching or a weakness in the wall of an artery that goes to the brain. And if that ruptures, and it can bleed into the brain, causing very significant problems, including death and a very serious stroke.
So they're really serious conditions, and obviously a lot of patients have a lot of anxiety about it. What are some of the signs that we look for to say, listen, I'm concerned about this, need more of a workup?
So aneurysms, unfortunately, are most often found when they bleed into the brain, and those can cause a severe headache, and often the worst headache of your life. It can cause symptoms similar to a stroke, with problems with speech or communication, or weakness on one side of the body. But the classic finding is a very severe headache. Sometimes they're found by chance if you had a MRI or a CAT scan for some other reason, and those don't always necessarily need to be treated, but they are very serious and should be addressed by a neurosurgical specialist.
Right, so one of the other signs I often talk about is things like double vision, for example. It could also be a sign. So we do see a lot of patients with aneurysms. How do you work it up? What do we do kind of get there as far as getting answers about, is this an aneurysm? What's the decision tree about whether you treat it or not?
So we often start with an MRI in patients who can have that, and that will tell us what the size of the aneurysm is and the characteristics of the aneurysm, and if it definitely needs to be treated. If it's over a certain size, oftentimes it will need to be treated, or if it's causing symptoms, it may need to be treated. Also, depending on what part of the brain it's in, it will need to be treated or not.
Right. And I think one of the things, we really have to individualize that treatment for our patients, right? So there's surgical options, endovascular options. You specialize in both. And,
that's right.
And how do you go about kind of walking a patient through that aneurysm treatment?
So as a dual-trained neurosurgeon, that means I'm qualified to do open as well as endovascular treatment, meaning similar to a cardiac catheterization, going up from the inside of the arteries. And the way we decide on that is really dependent on the characteristics of the aneurysm. The majority of aneurysms today are actually treated without open surgery through the leg. That being said, some aneurysms are only best treated with open surgery, and the outcomes are just as good as going through the leg, and often more durable.
Okay. Yeah, and I think the big thing I always emphasize is everything's individualized to the patient, their goals, their anatomy, and I think that it's really a decision process and a conversation between you and that patient and the family. Do you have any other thoughts on that?
No, that's right, and that's why at our practice we know there's a lot of anxiety often associated when patients find out if they have an aneurysm, and we try to expedite getting these patients into our office as quickly as possible as a semi-urgent basis, and evaluate their studies with them so we can put them more at ease in going forward to decide if they do need treatment or not.
All right, thanks so much.
Thank you.